Encounter is brought to you by the Broome County Council of Churches, where we connect compassion with needs as we inspire growth with dignity. You'll find us in special places throughout the community. For those who remain hungry, we provide meals. For those who are challenged, we build wheelchair ramps. We comfort those who are ill, minister to those who are confined, and we remain an advocate for change and understanding on behalf of every element of our community. Connect and inspire. Encounter the Broome County Council of Churches.
Welcome to Encounter. I'm your host, Dave Alexander. Today my guest is Jamie Welch. She's from the Broome County Health Department. First off, tell us a little bit just about yourself, maybe where you went to school, how long you've been with the health department and everything.
Okay, well, my name is Jamie Welch, and I am a sanitarian for the Broome County Health Department. I have been there for 4.5 years. I am a native to this area. I grew up in the town of Binghamton. I went to Susquehanna Valley High School. I received my Bachelor of Science degree from Oswego State University, and I have a Master's in Environmental Management from the University of Maryland University College. And just recently, I have been taking over a new grant that we have at the Health Department, the Healthy Neighborhoods Program. So I am coordinating that. Okay.
Maybe you can, exactly what is the Healthy Neighborhood Program? I mean, what does it look at and why? I mean, why is Broome County doing this to begin with? So.
Absolutely. It's a New York State grant that has been around for approximately 17 years. This is the first year that we have applied for such fundings, and we were awarded $1.2 million over the next 5 years. It basically looks at health and safety concerns within residents' homes and looking to make their homes safer and therefore impacting their health in a positive way.
Okay. What is an environmental health hazard?
An environmental health hazard is something that can be found, a toxin or a substance that can be found in our air, our food, or water, and it can potentially negatively impact our health.
Okay. Who really is at risk for this?
Yes, anyone can potentially be at risk for this, but particularly elderly and young children.
Okay.
They tend to spend a significant amount of time indoors and therefore being exposed to these types of hazards.
Okay. Now, your main focus is on homes. Okay.
Yes, our focuses are at homes. We'll be looking at certain criteria such as environmental triggers for asthma. We'll be looking at indoor air quality issues, talking to people about smoking and radon, mold, dust, things like that. We'll also be talking about residential injuries due to falls and fires, and we will also be looking at lead poisoning prevention types of issues within the home.
Now, is there any chance that eventually this program will expand from homes, maybe look at churches and different things? Do you see that in the future? Or is it mainly just the funding gets geared to look at homes at this point in time? At
this point, it is geared to look at residential homes since people spend up to 90% of their time inside of their homes.
Okay, that's kind of interesting to know. I mean, when you think of, you're right, 90% of the time is at their own home, but also then you get to the workplace and different places and,
Absolutely. Absolutely. Inside environments can become or be more toxic to people, but this grant primarily looks to address their residential homes first.
Okay. Now, how can the Healthy Neighborhood Program help residents?
Well, what they can do is basically, if they were to contact us, they would have a home health safety survey done on their home, where Healthy Home staff would go into their home. They would look at health and types of safety issues within the home. We will be looking at appliances to see if they're
Okay.
vented properly, looking and checking smoke detectors and seeing if there's fire extinguishers, looking for carbon monoxide detectors. Also talking to people about having exit plans in case of a fire,
Okay.
or making sure that the poison control numbers are posted, and if there are young children, talking to them about child safety items.
Okay.
If there are people living in the home who may be at risk for falls, talking about fall prevention
Okay.
and different sources in the area that they can call to get additional help.
Now, the grant that you have, is that geared to specific locations at this point in time?
Yes, it is. This is a 5-year grant,
Okay.
but this first year, after crossing data that had to do with hospitalizations due to asthma, fires, code complaints, residential injuries, and falls, we are looking at 2 census tracts in Johnson City. And these census tracts are from the City of Binghamton JC line. They go west to Riverside Drive. They go north to the second set of railroad tracks and south to Floral Avenue. We also are able to go in 2 census tracts on the south side of Binghamton. So that is basically the town of Binghamton line, east to Sandy Beach, north to the Susquehanna River, and west to Mill Street.
Okay.
But each year we will be looking to try and expand these areas, as they're a pretty targeted approach this first year.
Okay. Now, how did you determine that these were going to be the areas that you're going to look at this particular year?
Right. Well, when we were writing the grant application, we obtained statistics and looked at all the data from all these different areas as far as hospitalizations
Okay.
rates due to asthma. Being the radon levels, we are in a radon belt, looking at places that potentially could have mold concerns, even left over from the flood of 2011. Also looking at the age of housing stock and the percentage that could possibly have lead paint. We also looked at code complaints and the percentage of fires. So that's where the data has taken us this
Okay.
first year.
Okay. Now, I'm assuming the people call up there and want to have someone come, what do they expect out of a home safety check or survey?
Well, during a home safety survey, we're going to address potential health hazards. So first, we're going to go through a checklist with the resident. We're going to be looking at various things that could negatively impact their health. Like I had previously said, the unvented appliances, batteries and smoke detectors, things like that. We will be educating the residents on the hazards that we do find. We will be taking carbon monoxide readings while we are there in the field. We also will be providing a radon test to leave with the resident with the self-addressed envelope so that they can mail that. And basically, once we are done talking about all those things, the tools that we can provide to try and make their homes safer, we will be doing so, such as if their smoke detectors are there and working, we'll replace the batteries.
Okay.
If they are not, we will provide them. Same with the carbon monoxide detector. We leave a fire extinguisher every resident that we go to, if there is not one functioning, with the premise and the discussion with the resident that the fire extinguisher is not to stay and fight the fire. It is to, if their exit is blocked during a fire, to get them out.
Okay.
I don't want anyone to have a false sense of security, but rather just to get out safely. We talk to the family about having exit drills and planning them and practicing them, and then having a meeting spot for the family outside the
Right.
home, where if people were to get separated, where they will meet up and that everyone knows about that. We also provide cleaning supplies. We talk about and educate residents on the necessity of doing their regular cleaning in a wet technique
Okay.
to keep mold down, dust, also to not kick around any lead dust that may be in the area. We provide Swiffers with the wet mops
Okay.
and the buckets, and we talk about the importance of washing dishes, not leaving dishes in the sink overnight, as that can provide a food source for pests.
Right.
Or we look for dripping faucets and things that could be not only a water source for pests, but it could also signify a plumbing leak where there might be a mold issue. While we are in the home, if at any time the carbon monoxide levels are high or we smell natural gas, we get out immediately, encourage the residents to do so as well, and call all the necessary people. We will have cell phones on us so that we can make those appropriate phone calls in the field. But if there are other concerns that may not be life or death, such as they had issues or wanted to talk to code about something or whatnot, we will have all those numbers on us and can help residents make that phone call while we are there. They can use our phone if they do not have one or minutes available, and that is what that is designed to do. So we are there to help.
Right.
We basically will talk to residents about radon, about the dangers of radon. And a lot of people have heard of it but are unsure of what they can do about that it's naturally occurring, that it is and can cause cancer. So what we will do is leave that short-term test, talk them through it, fill out the whole card for that with that self-addressed envelope. All they have to do is to put it back in the envelope and mail that right off to the post office.
Now let me ask this question. Everything that you've talked about so far, it sounds like there's lots of people doing it through the health department, or is it you got a large staff, or?
It is essentially myself and another staff person. So we are happily very busy, which is wonderful. We encourage anyone with any questions to call us and ask questions, absolutely. And if you're not sure if maybe this first year you fall within that area, we would love to talk to anyone and everyone. That is absolutely to spread the message of this program. We all have health hazards in our homes, but we can learn to live with them safely, and we can learn to fix them with what we have. Even if you rent, there are small little things that you can do within your control, and you can improve the safety of your family immensely.
Okay. Now, one of the other things that you're talking about, like the supplies, I'm assuming, like you said, you provide a Swiffer, that type of stuff. Now, this is free to the homeowner. They don't have to pay for anything. You give them the fire extinguisher. So there's no cost. Do they have to sign anything to acknowledge they've received this, or it's just you giving them everything?
This is a free service. This is basically the monies in this grant. Instead of many staff people, it is going to the things that people need to try and help. So it is absolutely free. Where there is a need, we will have these kits with us in the field and are prepared to give them out. We also do provide a demonstration on switching regular cleaning techniques to our wet cleaning techniques. It's sometimes everyone knows sweeping and dusting and whatnot, but just changing our technique just a little bit to keep those dust levels down can make such a huge difference. Absolutely.
So I'm assuming, like with the fire extinguisher, do you kind of give them a basic, this is how you use it, that type of thing?
We provide lots of educational materials, and as we go through the safety survey, when we are sitting down after the basic inspection of the safety items in the home, as we are handing out the free things that they may need, so let's say the fire extinguisher, we talk to them about the acronym PASS. Pull, aim, squeeze, spray. We take the fire extinguisher out of the box and we look at the pamphlet together. And we talk to them about all of the, following the manufacturer specifications. And this is a smaller fire extinguisher, so that, again, we premise that this is to get out safely, not to stay and fight it. But then we have them explain pull, aim, squeeze, spray, so that there's that understanding there before we leave. Absolutely.
Now, I guess from a curiosity standpoint, you've been out doing the program. Have you gone into homes that are completely a disaster, and it's like overwhelming as far as trying to get the people to understand how to make it more livable?
It has been a bit tricky. I guess the best thing about this thus far is going into a home where there were no functioning smoke detectors or even a carbon monoxide detector, but when we leave,
it's all there.
There are.
Right.
So that rest assured, if there happens to be a fire or whatnot, at least now that there are the basic safeguards in place that were not there before. So that really stressing the importance of changing those batteries and things like that. People have been very receptive and very welcoming and really are eager to learn how to make their homes safer. So we haven't really hit that stone wall, which is, it's very encouraging.
I was going to say, because I just, lately in the paper and even on some of the TV shows you read about the people who are the hoarders, that type of thing, and it seems like you hear more and more of that, and of course probably those aren't going to be the people that will call.
True.
But it's just, and then also with the apartments, renters, the landlord's supposed to take care of smoke detectors, carbon monoxide, and a lot of them don't. So it is a great thing that, now if you go and say a renter, do you have to have permission from the landlord first, or you can just?
No, we do not. And what we actually do is after this home safety survey, we will send a letter to the property owner and let them know what we provided in hopes to let them know that we had helped them out on a future code inspection or whatnot. So to create a positive message, because it's not to go out and judge anyone or to look down upon anyone or to say you didn't do this, and we're looking to make things safer, healthier now for people in the homes now. And if there is a situation, hoarding or whatnot, there are different avenues that we can take as staff as well. I've created a community resource guide, which is basically an expanded 211 after doing a bunch of research. So different types of things that maybe talking to them about the hoarding issue, maybe even going so far as to contact a family member or adult protective services if need be. Health and safety and life, preserving life is, of course, our number one goal. If there is a life and death type of a situation, we will be calling the appropriate services, absolutely.
Okay, I guess that was my next question. You go into some place, now, we are getting the position where you would want to call code enforcement and say, hey, you really need to come in, especially a rental unit, that you feel there's something that's really needs to be taken care of? That puts you in a rough position, but I'm just thinking that not very often do people go into an apartment and you might find things that nobody else is ever going to find. So
absolutely, and depending on the severity of the issue or what the program can actually fix while we are there, we are prepared and have reached out and are working with the code offices in these areas to let them know. Absolutely. Short of, if the tenant wants to make that call themselves, we will help facilitate that as well right then and there. If they don't feel comfortable doing that but do not oppose us calling on their behalf, absolutely, we are prepared and fully able to do so and will do so.
Okay. Now, I'm assuming you've kind of mentioned that, but if people have questions, they can just call and ask you or someone else there, and you'll give them all the answers.
I will try my best, but absolutely, they can contact me at the health department. The phone number there to reach someone in the Healthy Neighborhoods program is 778-2847.
Okay. Now, I guess this brochure is something that if people called, this could be sent out to them. Is it?
Absolutely. Absolutely, as well as if they had particular concerns, whether it be mold or pests or lead, what have you, we would be more than happy to send educational supplies on that topic.
I know this kind of, it shows the two maps, the areas, and it goes into the asthma, the lead poisoning and so forth, but it really kind of covers a lot of the stuff, and then it tells about the supplies that you're giving. So I think if people, want to call the health department, and have one of these, this is a very educational tool to have, and then maybe they would want to have the inspection done too. So
absolutely, we encourage anyone with any questions, concerns, even if you know you live outside of the first year target area, just please call.
Yeah. Now, there are essentially 7 steps to take for a healthy home. What can make a home healthy?
Well, there are 7 key steps that we have learned in Healthy Homes training. It is first to keep it dry, to keep it clean, pest-free, safe, contaminant-free, ventilated, and maintained. So all of these 7 criteria, if they are not met, can lead to a lot of the health and housing concerns that we see, and a lot of the reasons as to why this grant was written.
Okay. Now, maybe I think people look at Broome County Health Department as a function of Broome County.
Yes.
It's initially funded by the county plus state funding and grants and everything. Now, I know you were involved in the lead program also.
Yes.
So maybe can you kind of highlight some of the programs that, so people are aware of what the health department does do besides just the Healthy Neighborhood program?
Absolutely. Well, the health department is located on Front Street, so we are not part of the county office building, even though we are a county entity. And within the health department, there are different divisions. I work in environmental health, and in environmental health, we have the lead poisoning prevention program, as well as healthy neighborhoods. We have the rabies control programs, restaurants inspections, pools inspections, bathing beaches, temporary residence, water facility inspections, sanitary surveys, all sorts of things that you would think about as far as the environment and different types of inspections that the environmental health department would do. There's also WIC is located at the health department, maternal child health, early intervention, cancer services. We have clinic services, pretty much a little bit of everything, it feels like. But yes, we are county government, but most of our programs are for the people, to try and help the public in our area. There is so much more that we do to really try and improve the quality of life for the residents here in Broome County. Basically, if anyone had any questions or concerns, I would encourage them to go to the gobroomcounty.com and click on the health department and really take a look at all of the different types of topics that we cover and try to help people with. It's quite broad. Absolutely.
And it's all, there's no cost for most everything you call, and you can call in and ask questions about anything or get information. And I know, the smoke-free program, the lead, we've talked about that on the Encounter program before. There's 2 programs that really benefit so many people, and so now you've added in this program, which kind of ties a little bit of those 2 programs into the Healthy Neighborhood, and you are right now looking at certain neighborhoods. So how do you see the program expanding over the next 4 years?
Well, we definitely want to look to expand the targeted area to be able to provide more services to more people, because there's a definite need, I feel, and I believe the community could completely benefit from this program. But as far as the smoke-free housing, how Healthy Neighborhoods incorporates that is, from every resident that we visit that does smoke, we are looking to have them take a smoke-free home pledge to help improve not only their health but their family's health. Also providing them the tools should they want to quit. We provide the New York Quits line and the Facts to Quit line, but we're looking to obtain 100% of those smoke-free home pledges of the people that do smoke in their homes and cars to not do that. Smoke is a very large trigger for asthma attacks as well. So that's, and the smoking indoors can severely negatively impact the indoor quality of air. So that is why smoking is a huge part of this, as well as the lead. That's another huge part of the Healthy Neighborhoods program, in that all of the houses around here pretty much are old.
Right.
The housing stock is old, and a lot of it is in deteriorated condition. We have essentially 50 new lead-poisoned children every year still in Broome County. That is too much.
Right.
And the testing rates in Broome County are low. It's New York state law to have children tested at age 1 and again at age 2.
Right.
And our testing rates are right around lower 20% of all children tested. So those numbers would just go through the roof if every child was tested as they should be. So this is just another avenue to get these key messages out to the public. And also placing referrals to those different programs, working in partnership with them to try and get that message out and make homes safer.
Yeah, it sounds like I listened to everything you've talked. I mean, I don't know when you have time to do everything that you're trying to do, under this grant. You've got to be very busy all the time. I mean, it's such a great way for people to have their homes checked out and stuff, but it's got to be very time consuming also for you to
it can be time consuming. We are looking to do 225 to 250 of these home safety surveys every year.
Wow, that's a lot.
Yes, it is.
Because I'm assuming that you go in, it probably takes, like, you're not just there for 15 minutes, you're there for hours.
Yes, right around an hour to 2 hours at most, depending on the size of the home. Some of the things that we go to look at, such as furnaces and hot water heaters, to see if they're vented properly. In a multifamily rental, tenants don't always necessarily have access to those. So within reason, we're not going to break down a locked door to get to the basement.
As we're beginning to run out of time, I want to thank you so much for coming and sharing this program. And I would encourage anybody to call the health department, get the brochure. If you live in one of the targeted neighborhoods, call and make arrangements to have your home inspected, or if you're renting, have it inspected.